topics of the day, everyone. For this topic, we will be having our concept of multiple sclerosis, still one of the disorders under your neuro. Okay? Alam nyo kapatid, ang multiple sclerosis na ito, this is actually comparable to the concepts of Parkinson's and also our previous topic, your myasthenia gravis. Okay? At sa araw na ito ay pag-uusapan natin kung ano nga ba ang pagkakaiba at pagkakapareho nila to the previous two concepts that we have just tackled. Okay, let's start this right here, right now. Okay, class, kapag sinabi nating multiple sclerosis, this is also chronic and progressive. Just like the concept of your Parkinson's disease, we've tackled that ang Parkinson's, kapatid, it does not happen in a very short period of time because it's chronic. Again, as we qualify chronic, ibig sabihin, class, it happens, okay, more than 6 months. Okay, yun ang ating indicator na ang sakit ay nagiging chronic. Now, progressive naman, kapatid, ibig sabihin, ang symptoms niya, may mga early symptoms or may mga early manifestations, and then later on, we'll be having these late manifestations of the multiple sclerosis. Another thing that we should be remembering about this one, kapatid, it is an autoimmune disorder. So, ibig sabihin, kapatid, because of some predisposing factors, okay, our body, no, is the one making, kapatid, okay, the disorder itself. Okay? Ang ating mismong katawan ang gumagawa ng disorder itself. Okay? Or may mga factors. Because there are some predisposing factors, okay, it later on reacts to these predisposing factors, thereby attacking itself. Okay? That's what we call, kaya siya tinatawag na autoimmune. Okay? So another, kapatid, here, antibody attacks the myelin sheath. This is the main problem natin when it comes to multiple sclerosis. Now, let's compare it to your myasthenia gravis. In myasthenia gravis, there's also the factor of antibody. However, the antibody in myasthenia gravis attacks, kapatid, okay, your acetylcholine receptors all throughout the body. Here, dito naman, kapatid, sa ating multiple sclerosis, ang nagiging problema natin, the antibody attacks the myelin sheath, okay, of the central nervous system. Okay? Yun yung tinatawag nating demyelination. Yun yung tinatawag nating demyelination. Another concept then that we should know, and another more important key information here, is that it is more common among females, just like your myasthenia gravis, unlike your Parkinson's disease, that's more common among males, and this is also common to ages of 20 until 40 years old. So this is quite similar to your myasthenia gravis. Okay? So let's proceed. Again, let's try to analyze or let's try to know what are the manifestations, or I mean the causes of your multiple sclerosis. What are those predisposing factors, okay, that leads to your body creating this autoimmune something. Okay, so first, let's talk about fatigue. So, kapatid, fatigue po ang isa sa mga causes or the predisposing factor, kapatid, kung bakit nagkakaroon tayo ng autoimmune reaction yung ating katawan, leading to the damage or attacking of your myelin sheath, which we call as your demyelination. Another, kapatid, is infection. Okay? Another is temperature change or the extreme temperatures, and also stress. So all of these things, kapatid, these causes the exacerbation na tinatawag natin on your multiple sclerosis. Kapatid, alam nyo ba, kapag sinabi natin sclerosis, just like on other concepts, sclerosis is actually a medical term that's specific for hardening, just like in your atherosclerosis. So, ibig sabihin, tumitigas, there's plaque, okay, in your blood vessels. Just like also in the concept of your varicose veins. Isa sa mga management class, okay, in your varicosity sa mga paa po natin is ang tinatawag nating sclerotherapy to avoid the rupture of your varicose veins. So, ibig sabihin, patitigasin natin yung mga veins natin o yung mga varicosities natin para hindi siya mag-rupture, which will be avoiding class further complications related to hemorrhage. Okay? So, dito, kapatid, these are the triggers to acute exacerbations. Okay, these are the triggers to the attacks. But again, we need to remember that your that your multiple sclerosis is autoimmune in nature, which attacks your myelin sheath or yung tinatawag nating demyelination. Okay? So let's now try to understand what are the assessments na makikita natin in your multiple sclerosis. First one, okay, mayroon tayong tinatawag na poor coordination, kapatid. Okay, now also we have this what we call as your Charcot triad, and you need to write this down because this is the pathognomonic sign class for your multiple sclerosis. Kapatid, kapag sinabi natin Charcot triad, that's a specific class dito sa inyo pong, okay, multiple sclerosis. And we need to remember your SIN or SIN mnemonics. What's that? First is your scanning speech. Okay, again, scanning speech, sulat mo. Okay, number 2, intentional tremors. Okay, and also your nystagmus. Okay, your nystagmus or your rapid eye movement. Ayan. Again, kapag sinabi natin, kapatid, na multiple sclerosis, nandiyan ang ating Charcot triad. Okay, which is your scanning speech, intentional tremors, and then your nystagmus. Now, kapatid, meron rin tayong difficulty in articulating words or tinatawag nating dysarthria. Okay, isulat niyo dysarthria. And also, meron tayong ataxia. Yan. Ataxia now is a type of gait, kapatid, or type of walking due to poor coordination. Okay? Also, nagkakaroon tayo ng muscle spasticity. And also, bowel and bladder dysfunction. Bakit, kapatid? This is because of the damage to the lumbar area. Okay? Kapag may damage sa lumbar area, we need to remember automatically it's bowel and bladder dysfunction. Now, kapag meron naman tayong damage to the sacral area, magkakaroon tayo ng sexual dysfunction. For this one, decreased libido for the women and impotence for our men. Yan po ang nangyayari sa atin. Okay? These are your assessments that's present in your multiple sclerosis because of the demyelination. That's why it's sometimes called as your demyelination disorder or demyelination syndrome. Okay? So now, let's try to talk about the interventions, kapatid, na ginagamit natin or ginagawa natin in your multiple sclerosis. First, we give your patient medications. So what are those medications na binibigay natin? First, it's because the antibody attacks our myelin sheath in the central nervous system. Ang gagawin natin, kapatid, is we will try to lower down the antibodies, okay, by giving steroids. We need to remember that your steroids actually affects your immune system. So, ganun po ang ginagawa. Okay, we give your patients corticosteroids to decrease the antibody. Also, we give your patient muscle relaxant. It's because of the increased spasticity na nangyayari sa ating muscles, and also just like in the symptoms of your ataxia, in your dysarthria, nagkakaroon ng poor coordination. So we need to relax and relax and relax the muscles of the body. So we give your patient muscle relaxant. And for your multiple sclerosis, one of the most example of your muscle relaxant that's given, we give baclofen to our patient. You write that down, kapatid, baclofen. Okay? It's a muscle relaxant given to decrease muscle spasm. Okay? You write that down, baclofen po ang binibigay nating medication. Okay, also avoid exacerbation. Okay? So, you avoid fatigue, you avoid infection, you avoid extreme temperature. So, those are the things, kapatid, no? Okay? Na we should be avoiding to avoid exacerbation. Also, we need to prevent complications. Okay? We need to prevent complications just like because it affects also your respiratory system, because it also affects your muscle coordination. We need to prevent coordination. I mean more complications, kapatid. So dito, also one of the priorities that we will be setting on our patient is safety. It's because of the poor coordination and ataxia. Okay? Of course, priority, safety. Now, also we need to remember that we give our patients palliative management in the concept of your multiple sclerosis. So, ang approach po natin dito is very symptomatic. Kung ano po yung symptoms na pinapakita ng pasyente natin, we immediately give the management that's needed. Okay? So, that's enough for me tonight, guys. So, see you again on our next topic as we go along. I think it would be the concepts of your Alzheimer's, yung AMLS natin. Also, we'll be talking about your Guillain-Barré syndrome. Ingat!